It's 9 o'clock on a Monday, the patients are rolling in. There's an old man lying next to me, waiting for his scope to begin. He says, Mr. GI man, the prep last night was fine. Now I'll turn a cheek and you take a peek and see what's doing behind. Pick up the scope, you're the GI man. Turn on your scope's bright light. My polyps await their inevitable fate, while your drugs have me feeling all right. It's a wonderful crowd for a Monday, but Judy gives me a look. 'Cause though it's not fancy, the schedule by Nancy is starting to fill up her book. And the nurses are so beautiful, it's hard not to stop and stare. As I walk in with a wink and a grin, yelling, yo, I'm digestive care.
Hi, I'm Dr. Kenneth Levine. Welcome back to Health Talk. You can see us on Uverse, Channel 19, or WEYW19.com. I'm here with Dr. Matt Soff. You know, Matt, we talked about the upper GI. It's important to talk about the lower GI for a few minutes about colonoscopies and colon cancer. Just touch on that, please.
You opened the show by saying that dentistry has made a lot of progress and that it's much more gentle, it's much better tolerated, and it's much easier than it was in the past. And as you were saying that, I was thinking the same thing happens with colonoscopy.
It's important to remember that of the several screening methods, only colonoscopy allows your doctor to view the lining of your entire lower gastrointestinal tract. Colonoscopy is capable of detecting inflammation, infections, ulcers, diverticulosis, intestinal narrowing, colorectal polyps, cancer, or other problems that may be present. The procedure is performed using an endoscope, which is a long, thin, flexible tube with a light and a tiny video camera attached to the end. The camera transmits images to a monitor, allowing the doctor to see the inside of the colon. In a sigmoidoscopy, the endoscope reaches only to the top of the descending colon. In a colonoscopy, the endoscope reaches through the entire length of the colon where it connects to the small intestine. Most colon cancers are found in the first part of the large intestine. Many others are usually found in the last part of the large intestine, or rectum. But colon cancer can occur anywhere in the large intestine.
I remember you telling me that you can cure colon cancer by preventing it.
Much
Something
better.
like that.
Well, this morning we did a woman, mid-50s, never had a colonoscopy before, found 2 asymptomatic polyps. One was small, but one was quite large, and obviously had been there for a while. There are times when a polyp is large enough that part of it has already started becoming cancer. So within the polyp, size of, let's say, a very small golf ball, smaller than that, part of the polyp actually has cancer cells in it. By removing the whole polyp, that cancer actually has been taken out. So by removing polyps, number one, we are preventing them from becoming cancer. And in some cases, we have found cancer starting in that polyp. We remove that polyp whole, and then by doing so, we have taken that particular cancer, early as it was, taken that cancer out of the patient. That patient is cured.
Before I forget, would you let our viewers know where they can find you, your address, your phone number, website, and things like that?
Well, my name is Matthew Soff, S-O-F-F, and I am located in Plantation, Florida. My phone number is 954-474-3262. We're in the Bennett Building, right next to Westside Regional Medical Center in the heart of Plantation. And we don't yet have email, but our website is www.digestivecareonline.com. That's digestivecareonline.com.
You know, as a periodontist, we take care of patients usually who are asymptomatic. Not many people know they have periodontal disease. They may know that they have cosmetic procedures. But in our practice, you know, February we're going to be celebrating 38 years in our office in Tamarack, Fort Lauderdale. When people come to see us today, we initiated a policy years ago that they can come to my office for free examination, consultation, and radiographs. they can at least find out about what's happening in their mouths, and then they have an opportunity to learn what optimal care is. They can also find out what happens if they decide not to have treatment. So those patients have an opportunity to visit us. We work with their restorative dentists, and then we get to refer them to fine doctors like you. Matt, thanks for coming in. I will see you soon. Again, it's Dr. Kenny Levine with Health Talk, and we'll be back next week. Thank you.